In part, addressing how we deliver care is a critical pathway forward. In addition to that, we still have to think about the entire ecosystem of healthcare, which means we have to continue to challenge ourselves, both from a private perspective as well as a governmental perspective, about how do we do that in a value-based mindset? How do we make sure that we are rewarding everybody that's involved in that delicate ecosystem in the right ways to ultimately incentivize healthier patients, members? At the end of the day, call them what you want. These are people, and we have to make sure that we're creating a better opportunity for them to have care and to have that in a more affordable way. And so the intersection around care and coverage, I believe, is also critically important to the future. And you've got organizations like Sanford Health and other regional systems that have a provider-owned or sponsored health plan, which gives us a unique opportunity to look at ways in which we can invest in better care for more people in a way that makes more sense, because we're not thinking about it in a fee-for-service background or perspective. One example I'll give there is investing in pathways. And so when we think about members who we're providing care for, by making investments in having individuals who will come and walk alongside them. And so these are individuals that have some clinical knowledge and expertise, but these are not our RNs, these are not our advanced practice providers or our physicians, but these are individuals who we bring alongside our members and help them navigate through the care process and help make sure that we can provide better opportunities for them, that we're hearing specifically what's going on, making sure that they're adhering to, medical protocols, to pharmaceutical protocols as well. And in order to do that, a lot of times those aren't reimbursed programs. But if you have an opportunity to care for a population of people where you're not worried about a fee for service or a per click basis, you make those investments because that provides better outcome and better care for those individuals, irrespective of what that reimbursement model looks like. One of the other areas that we've made investments in is our behavioral health therapists, and investing in those individuals to make sure that we have them embedded in our primary care clinics. As you talk to primary care providers across this country, they will share with you that they are the front line of identifying individuals who are either in a behavioral health crisis or they're likely to come into that crisis. And to be able to intervene immediately, as opposed to saying, well, you need to go out and schedule somebody else, we found that by embedding in our primary care clinics those behavioral health specialists, that provides immediate access for those individuals so that we can bring that provider into the room right away to begin intervening and meeting that individual's needs. And again, you do that when you have sort of a holistic view of it and you're not thinking about it necessarily from a traditional fee for service or per click basis. And we have to continue to push and incentivize those types of programs around this country to further transform the way in which we deliver care.